Well, hello. Welcome to Dear Healthcare Provider, the podcast where patients, providers, and policymakers meet to have purposeful conversations about health and the issues that impact access to care and health outcomes. Today, I am so thrilled to have a member of our community, our online community, with us today. I have with us Miss Stevie Rogers, and I'm going to tell you a little bit about Stevie, and then we're going to jump right into our podcast episode today. Stevie, welcome to the show, and I'm going to tell our listeners a little bit about you, and then we're going to jump into our questions, okay? All right.
Thank you so much.
Steve, absolutely. Stevie Rogers is a 37-year-old mom, and she is a dedicated healthcare professional working as a credentialing specialist. Her passion for healthcare advocacy in America drives her to advocate not only for herself, but also those around her. Diagnosed with type 2 diabetes, obesity, PCOS, and attention deficit inattentive disorder, Stevie understands the challenges of managing multiple chronic health conditions. In late March of 2023, Stevie joined TikTok to connect with others using GLP-1 medications. Taking a leap of faith and some courage, she decided to share her personal journey on TikTok. Hoping to inspire and support others facing similar health challenges. Through her advocacy and openness, Stevie aims to make a positive impact in the healthcare community. So welcome, Stevie, to the Dear Healthcare Provider podcast. And we actually met on TikTok, and I am so thrilled. And I feel like we are getting to know each other and sending each other private messages and things like that. And now here you are on the show. So yay.
Yay.
Welcome.
Well,
Welcome.
first off, thank you so much for having me. It is such an honor. When you asked me, I was just so grateful, just filled with gratitude. So thank you so much.
Oh my gosh, you're so very welcome. And so, I was drawn to your page because
Mm-hmm.
you were talking about being a slow responder to GLP-1s. And, on my page, I'm very open about the fact that I'm a bariatric patient. I had weight loss surgery so almost 7 years ago, actually 7 years ago this week, to be exact. And lost and kept off about 80 pounds. And I am maintained on several of the anti-obesity medications, and the main one being Mounjaro. But I, like you, have not seen this massive amount of weight loss, though I've been taking it now for probably 6 months at this point, and had been on one of the other ones before. And it definitely has improved my overall metabolic health. But just the frustration with, I'm like, well, how come I'm not a super responder? And so I went looking on social media to see if there were other people experiencing this. And I found you. And I said, well, you know what? Maybe we could talk, because this is like very relatable. So here we are. So, but anyway, tell us a little bit about yourself. I'm gonna give you a couple of minutes to talk just a little bit about yourself and, where you are on the journey. And I'm gonna let you go.
Oh, thank you so much. First off, what you just said just resonates with me so much. Thank you so much for, getting online and trying to connect with people such as yourself that might be a slow responder. So honestly, hi, I'm Stevie, as you know, and I have been obese my entire life. I really have. I was born 10 pounds, 5 ounces to a mom who did not know she was a diabetic at the time. I come from a long line of, genetically speaking, obesity. So there's a genetic component in my family for obesity. And then from there, of course, developed diabetes type 2 in October of 2021, a year exactly after having my son. It was a lot. And then from there, I think in the summer of 2022, met with a registered dietitian, and she advised, hey, there's this new medicine hot off the press called Mounjaro. Have you heard of it? And I had no idea what a GLP-1 medicine was, let alone what Mounjaro was. And I was like, I don't know. So I called my insurance. Of course, at the time, they did not cover it. It was not on the formulary drug list, which was very unfortunate. Had to suffer with other medicine that gave me terrible side effects for a whole other year. Come January 2023, I rechecked the formulary drug list, and lo and behold, it was on there. But of course, it needed a couple of things: a prior auth, drug step therapy, things that made it still hard to get accessibility to this medicine. Finally got on it March of 2023, and that's truly where I decided to start sharing my journey. At the time, to be clear, I did not know I was going to be a slow responder. I had a lot of hope for the category of the weight portion of it. According to the registered dietitian, she just said that it could also help aid in weight loss. So I thought, wow, this could be a win-win for me.
Yes, yes. You brought up several things that many of us who live with the disease of obesity, the disease of type 2, because I also had type 2, just been in remission just since my weight loss surgery. But you talked about access. You talked about, having to do other things before being given the medication that had the potential to give you the most bang for your buck, so to speak, in terms of your overall health improvement, right? And I think this is one of the things that I know on this show that I talk about, and have had some folks who work in policy on the show, have had some medical folks on the show, some of the leading obesity medicine experts. And this is this is one of the things that is really why we have to do the type of advocacy that we do, not only like in these spaces on podcast and online and using our voices that way, but it's so important to know that these are bigger policy issues that are driving our inequity, right, around being able to access it, because you or me or anybody else shouldn't have to jump through 5 different hoops because insurance says, well, I'm only going to pay for the third medication after you take these 2 or 3 or 4, just because it's an economic advantage for them, but not for the patient. So I think just being able to share your story in that way is just so very important. So,
I agree.
Yeah. So I'm sorry, but let me ask you this, you shared with me a little bit about your journey, what led you to pursue the medication. You were doing the things that you thought were good, that were going to improve your health, but those things weren't working. You sought out appropriate medical professionals who said, hey, we think this can help you. Then we start playing the insurance Hunger Games. Then we play what I call the pharmaceutical Hunger Games, right?
Yeah.
So I think that with that being said, knowing that this was something that could help you and jumping through the hoops before you started it, what did you feel? What were your expectations regarding the weight loss and the impact it would have on your overall health?
Well, to be completely transparent, because that's honestly the only way I know how to be. I mean, if anyone sees my TikTok,
Go
I'm
for
very,
it, girl.
very open.
That's
very
what I
open.
believe in.
Yeah, and it goes back to just I want people to know that excuse me, that they're not alone. So my expectations, to be honest, the only thing I truly had to go off of at the time was what that registered dietitian had told me, that it would help with my newly diagnosis of diabetes. It could help with some weight loss, and I guess I would say I was hopeful, and then it really wasn't until, Michelle, I joined TikTok in March of 2023, and I started trying to find mind-like people such as myself that are on this medicine, that I started seeing people be so successful at the weight loss. And I was like, whoa, could this be me? Could this be my life? And I'm going to, again, sake of transparency, I'm going to be honest. 2023 was a hard year for me on TikTok because, and I want to be very clear, I am so happy for anyone who's been able to lose successfully, whether you're a high responder or just like an average responder, and you're losing healthily 1 to 2 pounds a week. I'm so happy for all of my friends in the community. However, that doesn't negate the fact that I was feeling mentally, just discouraged, frustrated. It goes back to almost like the shaming that you do to oneself of, it must be my fault. It's got to be my fault. It's
Yes.
my fault. And I have been on this journey now for almost 2 years, specifically with the GLP-1 medicine. March 2025, I think, will be 2 years. And so on this journey, I've just realized how much and it's so hard to do, because it's so hard not to do this because we're human, right? But I try to tell people all the time, try not to compare yourself to someone else, because no one else has my genetics, my other comorbidities that I have. No one else is me. Therefore, how can I set such an unrealistic standard? Does that make sense?
Oh yeah, I was going to say
Yeah.
let's unpack that a little bit, because I can so
Sure.
relate to you. Okay, 120%. So listen, this is a safe space. This is a safe podcast. I want people to come on here and keep it real, because
Yeah.
what I want to ask you, prior to getting the GLP-1 medication, just share with us, our listeners, what were the things you were doing or told to do that would help you to, quote unquote, lose weight, improve your
Yeah.
health, get your numbers straight, and then we get access to this medication. But I want you to just briefly tell us, what were the things that you were doing? And we know what the traditional healthcare system
Yeah.
tells us that we need to be doing, blah, blah, blah. But I'm going to let you speak to that.
Of course. Yes, of course, my lived experience. So, I mean, to be clear, before I was even diagnosed as a diabetic in 2021 of October, years, my whole life, it feels like almost my whole life, at least, I'll be honest, at least from my early 20s up until, obviously, I guess, early 30s. I had the mentality of the diet culture, the toxic diet culture. I did extreme diets. I worked out like crazy. I did 5 days at the gym and nonstop, I think maybe like 2 hours a day. And then of course I also have, as you call it, PCOS, I say PCOS. So of course being diagnosed with that in my early 20s, I didn't realize at the time, because again, it wasn't really like advised to me, or I don't know. I guess I didn't have enough practitioners or providers around me to help advocate for me. And I was so
Yes.
young, I guess I just didn't know how to advocate for myself, if that makes sense.
Exactly.
And
Well,
so,
and I'm going to
yeah.
just so our listeners know what PCOS is. I know many of us in this community know, but it's polycystic
Yeah.
ovarian syndrome, which impacts your hormones and makes it difficult for people to lose weight. And it's very common for people living with obesity to have these kind of comorbidities, to have the PCOS,
Yeah.
because most of us who live with this level of obesity have insulin resistance, and so there's a lot of underlying metabolic
Yeah.
things going on that makes it hard, so that when practitioners are telling us, oh, you just need to eat less and exercise more, and we are literally doing that. And Stevie, I can relate to you, because I can remember as young as, well, actually, I can take it all the way back to elementary school, because I too have lived with obesity my whole life. It runs in my family as well. And I remember deciding between, now think about this, my 5th and 6th grade year, that I was going to lose weight because I was tired of being teased by everybody. And I lost 40 pounds in a summer. Come on, like 11 years old, 11, 12 years old, you know what I'm saying? 10 or 11 years old.
Yeah.
And so I get it and I understand, but I also want to capture, what was the kind of care that you were getting along the way? Did you feel like healthcare practitioners, providers were providing the necessary patient education that you needed, even to do things?
Yeah.
I'm gonna let you answer that, because I think I know the answer,
Yeah.
but I'm gonna let you answer
Yeah,
it.
I mean, it's so sad, right? Because as you say, you probably know the answer. It's unfortunate, but you're right. No, I did not. I did not have the proper tools or the proper education. And to be fair, I don't even know if society at that time, back in like the early 2000s, truly understood that obesity is a chronic disease. Now, I do believe in 2003, the American Medical Association officially came out and said, hey, obesity is a chronic disease. But
And that was in
I don't think anyone.
2015. It
Oh, it's
wasn't until
2015. So,
2015 that they came out.
okay. Excuse me.
2015, the
Sorry.
American
Thank
Medical
you.
Association came out and said that, okay, well, obesity is definitely a disease. It's complex, and we probably
Okay.
should be treating it differently. That's a long time, though, right? That they said
Yeah.
it, and
Oh,
we are
yeah.
still having these
Yeah.
conversations. So
And
anyway,
so
continue.
yeah, Yeah, thank you for correcting me. So
That's
yes, so
okay.
2015, they officially, said, hey, this is a chronic disease. But I don't think people hear that, and I don't think they understand the
Mm-hmm.
complexity of what that means. Same thing with type 2. I think there's a lot of misinformation around that as well.
Mm-hmm.
And so, no, I need to answer your question. No, I did not have the proper education provided to me, or I think enough providers, physicians, what have you, around me to not only be sympathetic, but also not just look at me as a number, like, oh yeah, she's I mean, bluntly, she's fat, so that's what's wrong with her. That's the
Mm-hmm.
reason why she's got all this going on. And it's like,
Mm-hmm.
I don't think you understand what. And I didn't truly, to be honest, I truly didn't understand how obesity works. It wasn't, and here's a, I don't think I've ever said this. It wasn't until I joined in March of 2023, on that journey, that whole year on TikTok, the GLP-1 community, that I realized I had this huge aha moment of, oh, listening to like obesity doctors on there and like my peers on there. Oh, obesity isn't actually a choice, and I'm not lazy, and it isn't my fault. Oh, and me having PCOS, that's not my fault. Insulin resistance, that's not my fault. Type 2, oh yeah, that's also not my fault. And even me telling you
Mm,
that now, Michelle, uh, it's
yeah.
it's hard for me, and I'm going to be honest, it's hard for me to even accept that at times, because again, being it's kind of like this mind. I don't know how to explain it. It's just
Oh
like
yeah.
this.
Well,
It
it's
mess.
really
Yeah,
it's about the shame and the blame that diet culture
yeah,
has been very, very loud about, right? Because
mm,
for folks like us that have lived with it all of our lives, right? So there's
mm,
the weight bias. When you're a kid, other kids saying things to you, family members,
oh yeah,
maybe well meaning, who feel that it's their appointed duty to say something about your
yeah.
weight when you come to the family gathering.
Hmm.
I remember
Hmm.
those things as well. And I
Hmm.
think that just even
Yeah.
talking about it, like I can see your face and I can see your reaction, and that being
Hmm.
a very sensitive thing, because I think
Yeah.
what people don't understand is diet culture also causes us to develop implicit bias, right? That we've
Yeah.
internalized that bias, and we do
Oh,
think it's our fault. We
yes.
think that we're
Hmm.
not, like, we're out here, we might be doing hit classes, we might be out here running and doing all the things, and so
Yeah.
we don't get the result
Hmm.
because we've got these underlying issues, and then we go, well, I
Hmm.
must not be doing enough because this is what you're supposed to do. But the truth is, we've been
Yeah.
told a lie. We've been told a lie that all it takes is
Oh,
eating less and exercising more. And I'm at the stage now
yeah.
where I'm so grateful to have this platform to be able to
Hmm.
boldly, with my chest, as they
Hmm.
say, to say, that's
Hmm.
bull. And I'm not going to let you put that on me, and I'm not going to put it on
Hmm.
myself. And guess what? I'm going to
Hmm.
also advocate that other people are not subject to that, and that we are going to
Yeah.
be loud and proud about saying, we have a disease that deserves to have
Hmm.
comprehensive care, and just like anybody else, and we're not going to allow you
Hmm.
to put us in that box. And so
Mm.
I think that,
Hmm.
you are exhibiting and expressing the thing that many of us, God bless the people we haven't found yet, who haven't found our community to give them
Yeah.
voice. And I hope that they
Yeah.
find us and that they too can have voice, and that we can be examples
Hmm.
of being advocates in a way that says, you will not
Hmm.
marginalize me because I have something that I cannot control. Now, that doesn't
Yeah.
mean, and I think you would agree with this, that doesn't mean that we don't need to make different choices around our health. There may be certain things
Oh,
that you and I
yeah.
don't eat
Hmm.
because it is not the best for our body, but it doesn't
Hmm.
mean that, there's something wrong with us. It just simply means, like
Hmm.
people who choose to be vegan, for instance. I mean, I'm not
Hmm.
blaming and shaming them, but they've discovered that that's
Yeah.
what works better for their body.
Hmm.
So it's the same for us. But the
Hmm.
addition to that is we need to be able to walk into a doctor's office, be in
Hmm.
society, and people not judge us, and we not be shamed and blamed to judge ourselves.
Yeah. Oh my gosh. Everything you said, it just brings me to tears almost. I just resonate with everything you just said. I couldn't agree more, Michelle.
Yeah.
Wow. Sorry. That's just a lot to unpack. You're right. I like boldly saying with your chest, it is not my fault.
Yes.
And that's why I want to share so much of my journey, especially as a slow responder. I'm sure you can relate to that. I want
Hmm.
people to know, even as a slow responder on a GLP-1 medicine, it's not your fault, and
Mhm.
please don't shame yourself. And I am guilty of still doing that from time to time, but I'm trying to unlearn things, as I've told you before. It's so
Mhm.
hard, but every day I just take it one day at a time. And I
And
just
that's
try
and
to
that,
unlearn
and you know what, and
things.
that is a great point, Stevie, is that we do have
Hmm.
to unlearn, we have to unpack, and even that means,
Mm.
because I'm a big proponent of having
Hmm.
therapists. I say we
Oh,
need a
yes.
lot of tools in the toolbox, no
Yes.
matter what chronic disease you're dealing with. But when you're living
Hmm.
with this and the things that you so transparently shared about, like, so you find the community and you're like,
Hmm.
oh my God, these are my people. And I can so relate to that. These are my people. But then it's like, well, wait a
Hmm.
minute, like they're losing like 50 pounds, and I'm like, I'm
Oh,
over here
yeah.
struggling to lose
Yeah.
the 10 that I've lost or what have you, right? And so there's a
Yeah.
lot of
Hmm.
emotional things that
Mm.
that you've got to
There
deal
are.
with, right? And so I think I want to
Hmm.
ask you, like, how have you stayed motivated during these
Hmm.
periods where the weight loss is slow? Because you've said you've been on it for 2 years, you've been dealing with this for almost 2 years.
Almost,
What
yeah.
have you
Hmm.
found has helped you to just continue on the journey to battle
Hmm.
those challenges that we have? I mean, we have
Oh,
them.
it's a very important question and thoughtful one. So thank you for asking it. And forgive me if I get a little teary eyed.
It's all
It's
good.
emotional. I don't really think about it until I guess you're asked. You're asked it. What? Yeah. For the first thing, going back to what I just said, I have to take it one day at a time. I have
Mm-hmm.
to take it one day at a time because it's too overwhelming if I don't. So that's the first thing. The second thing is I've had to learn, as I mentioned before, along the way, and it's been hard, trying so hard not to compare myself to someone else, no matter if a lot of people in the community are seeing such success with weight loss. I have to remember, and I think you had said too, Michelle, at one point, I think you said it, that they're finding out there's about 15% of us who are slow responders, correct?
Yep, correct. That's right. That's what the
Yes,
research
and
is coming
so
out. Mm-hmm.
right, and so also tying into that, I tried to also focus on the scientific facts of it all,
Mm-hmm.
because it seems to help me. It seems to like kind of pull me back to reality and get out of my own mindset and think, okay, this is the actual scientific facts behind this. Um, it's still not my fault, if that makes sense. And then
That's right.
also figuring out what does work for me and what may work for me. And this is so important. What I say all the time in my videos on TikTok. What may work for me may not work for you, may not work for the person
Yes.
behind me or the person to the right of me. And so I've had to personally, again, because I always say this, in my body, in my genetics, and my comorbidities, I've had to calorie count. I try to be very mindful. I try to stick to like 16 to 1700 calories. Again, that's just for my body. And so
Mm-hmm.
I try to make that so explicitly clear, because I'll be honest, I see a lot in the community online. I don't know if it's conveyed enough to the people who are watching, who are desperately seeking for answers, right? Um,
Mm-hmm.
if that's communicated enough, like from the person making the video to the viewers, if that makes sense. And the reason why I think that's so important is because of people like you or I who come on and who might be a
Mm-hmm.
slow responder or may not know it yet, right? And then get so discouraged and feel like yet again there's something wrong with them, you know?
Yes, yes. No,
Um,
that's a great point. And you and I, when we
mhm.
talked the other day, I was saying to you that, even with these treatments, right? So with GLP-1s,
Mhm.
no matter what, and you shared with
Yeah.
me another medication that you had been on for your type 2, and your
Mhm.
experience was very different than my experience with it, because I had been on
Yes.
that medication too prior,
Mhm.
when I was my type 2 was not under control. So I think that
Mhm.
your point is well taken. And I think, so here's the blessing and the curse of social media, right? There's a lot of
Yeah.
people who come on and it's like, this is what happened for me and this will happen for you.
Mhm.
It might, but you also need to realize
Yeah.
that your body is different, your genetics are different. And so
Yeah.
it might not be the same. Just like you and I are looking at
Mhm.
people who are on GLP-1s, and I'm like, I've had weight
Mhm.
loss surgery. I just knew that once I got on
Yeah.
Manjaro, girl, I would be able to get the rest of the 50 pounds off. And it's like, yeah, no,
Mhm.
but my metabolic health is slamming. It's great.
Mhm.
You know what I'm saying?
Mm.
I'm just
That
right. So
part.
that, right, right.
That.
It's that part, right? And so I think
It
that the
is.
other thing that people
Mhm.
need to realize is that
Mhm.
celebrate the things that are happening for you,
That part.
right?
Mhm. Yes.
It's like
Oh, and that's
celebrate the
actually,
things.
thank you for saying that. So actually, to tie into that, so not only everything I just had just stated, but also focusing. And I truly do not blame or have any resentment towards anyone in the community, Michelle, or the medicine itself. I
No.
actually am very much an advocate if you want to get on a GLP-1 medicine, even if you're a slow responder. And here is why. And I think there's a beauty to people like you and I who are a slow responder. And I try to have this unique perspective, and I try to also convey this in my videos. It's not just about the weight loss part. Yes, it that is a
Say,
healthy
wait a
side
minute. I'm gonna
effect.
stop you, Stevie. Say that again. Say that again. Our listeners need to hear that again. It's
Okay,
not about.
so it's not just about the weight loss portion of
There it
taking a
is.
GLP-1 medication, and this is why. This is where you and I have a unique perspective, who's a slow responder. And in a way, I think it is a blessing that we're able to communicate this to society, not even just online, but like society as a whole, is that
Yes.
these medicines, like they're proving to help us so much in our bodies. Okay, for example, obviously it's helped with my A1C. In fact, and this is just for my body again, but it has
Mm-hmm.
been the only medicine for the diabetes portion of it to actually help me become a controlled diabetic.
Boom. There
And
it
so,
is.
so that's the first thing. And then the second thing
Mm-hmm.
for me, inflammation in my body has substantially come on down. That's the second thing.
Mm-hmm.
And then the third thing I would say that stands out as a positive thing of taking this medicine, apart from the weight part, right, is my PCOS, as you call it. I used to have very irregular menstrual cycles. Full disclosure, that's pretty common,
Mm-hmm.
right, with PCOS.
Yes.
So ever since taking this medicine, like clockwork, Michelle, boom, monthly menstrual cycles, and I
Wow.
just and so
Wow.
it is healing me from the inside out, right? That's what I
Yes.
call it. And I want to be very clear
Yes.
too. Like I don't call these medicines. This is just my opinion. You don't have to agree, or no one has to agree for that matter.
Mm-hmm.
But I do not call these medicines miracle drugs, because to me, a miracle would
Nope.
be you take one injection, boom boom, everyone loses the weight they want, and you're cured. There's a cure for obesity. There's a cure for type 2 diabetes. But with that said, I still think these are life-saving and life-changing medicines, and I am forever grateful. And
Yes.
I will never talk bad about them ever in my life, even if I'm never successful at losing a substantial weight on the medicines. It does not negate the fact that it has helped me with other things, right?
I think that's just so powerful. So
Yeah.
how's that for non-scale victories, right? I mean, because those are the
Yeah.
life-changing things that these
Mm,
medications can do. And I would think about for
mm-hmm.
myself, my mother died of a massive heart attack at the age of
Yeah.
71. My grandmother
Yeah.
died of a massive heart attack. She was older, and
Yeah.
my maternal grandfather died of a massive stroke at the wheel of a car. So my cardiovascular cards are a little sketchy, okay?
Yeah. Yeah. I
But
hear you.
the beauty, right?
Yeah.
But the beauty of these medications, and the research is coming out every day talking about how it's healing people's cardiovascular health. It's improving the inflammation in the body, which those are the things that leads to, right, a lot of the cardiovascular problems.
Yep.
So whether you lose
Mm-hmm.
5 pounds or you lose 10 or you lose none, if you that's
Mm-hmm.
what you get from the medications, listen,
And
we won, right?
yes, and I think it's just because e- exactly, I could not resonate more with what you just said. We won.
We
And
won,
that is
right?
where I always try to come from a place of gratitude and have the perspective of it's not just about the weight loss. That is a positive benefit that can happen for many people, to be very fair. It's not everybody
Yes,
though. And if it's not,
yes,
that's okay. And I love what you say, because it's so funny. I call it my tools in my toolbox as well. I love that you say that.
yes,
This is just
yes,
one tool in my toolbox, right? There's
yes,
many different
yes.
things that I have in my toolbox. And on days that I feel very down and I feel very discouraged, I try to come back to the gratitude part, because that's what keeps me, I guess, just level headed. It reminds me of why I'm on the medicine. And it's not, again, just about the weight, even though obviously it's hard living in a bigger body because of, well, I mean, it's painful. It can be very painful just, being heavy, right? Moving around a lot.
Mm-hmm.
But
Mm-hmm.
but still, I still try to be very grateful. Yeah.
Yeah, I love that. So it's like being grateful, recognizing what your non-scale victories are, and not
Hmm.
comparing yourself to other people.
Yeah.
Like those are these
Yeah.
three really big things I think that it's important for listeners and anybody living with this disease to really
Hmm.
understand is that, you know,
Hmm.
we have a wonderful tool in these medications. And I also
Hmm.
want to highlight the fact that you said our toolbox, right? Because I use that all the
Hmm.
time and say we
I love it.
require multiple tools. And when I'm doing advocacy,
Hmm.
even on a higher level, you know, I tell
Hmm.
policymakers and I tell physicians and
Hmm.
things, I'm like, listen, it's not either or. People living with
Hmm.
the disease of obesity, we need to have access to lifestyle change programs. Nobody
Mm.
gets a pass from that,
Yeah.
right?
Right.
You know, we have to
Hmm.
be able to have access to these medications because we don't
Hmm.
know which one's going to work, right? Some may work for you, the other one may not. You
That.
may be able to tolerate one and not the other. So we need to be able to have
Hmm.
that. We need to have
Hmm.
access to behavioral health care because, as we're talking about
Yes.
the shame, the blame, the internalized
Hmm.
stuff, the head stuff that we have to manage
Hmm.
in terms of living with this disease, you have to have
Hmm.
access to that. And we need
We do.
providers who are well trained, who are not going to
Ugh.
shame and blame us, right?
Yeah.
Who are going to
So
see
important.
us, who are going to
Hmm.
hear us and
Yeah.
give us the information that we need. We have an obligation. And I'm a nurse.
Hmm.
So, you know, I come big and
Yeah.
hard at other
Hmm.
professionals if I think that that is not what's happening because I'm like,
Yeah.
patients deserve better. Now, and I will also
Yeah.
say
So true.
that physicians who don't understand this, they also deserve better. And what I mean by that is we need to be able
Mhm.
to, they need to have training in their, you know, when
Yes.
they're going to school at the academic
Hmm.
level, they need to have
Yes.
training. Like med students
Yes.
need to have it, and we're getting better at that. You know that it's
I hope
being
so.
talked about now, and it's being integrated into
Hmm.
more and more curriculums. But the point being
Yeah.
is that on both sides of the aisle, everybody needs to
Hmm.
have the tools so we can all work together. And we're talking about. I just saw a local
Hmm.
news story the other day. In fact, I recorded it on my phone because I said, you know what,
Hmm.
I'm going to include this in one of my posts because they're talking about despite all this stuff we now know, the obesity rates are
Hmm.
still increasing. They're still increasing. Like 42, I think it's
Ah,
42% of the
it's rough.
population is living with obesity or overweight.
Yeah.
42%. That's almost half.
Yeah.
You know, and
It
so I
is.
think that
It's heartbreaking.
it's heartbreaking. And so I think we have
Hmm.
to make sure that we continue to bring these issues to the forefront in forums like
Yes.
this so that
Yeah.
everybody who's involved, healthcare providers, patients, policymakers, and the general public
Hmm.
understands what this is and we need
Hmm.
to have the tools that we need to deal with it. So as we are coming closer to the end of our our time, we've got a few
Hmm.
minutes, but
Okay.
there's another thing I want to ask you, just based
Hmm.
on your journey, and you said some of these, but I'm going to flip it because you said some of these around the patients. But based on your
Hmm.
journey, what do
Hmm.
you wish healthcare providers knew? Two or three things that
Oh,
you wish healthcare providers knew
oh,
when somebody
I
who's
got it.
living with obesity walks into their
Yeah.
office. What do you wish they knew?
I three things. So this is going to be maybe an obvious one, but sadly, you'd be surprised, or maybe you wouldn't be, but collectively, society might be surprised. One, that we're just people too, with emotions, and
Mm-hmm.
we're more than just our weight.
We're more than our
Two,
BMI, I say. We are so much more. Yes.
oh yes, we
Yes.
are so much more. Yes, I'm not just my BMI. Yes, correct. So that's very well said. And then two, kind of tying in with that, kind of actually what you were saying before, I wished that providers had more education to understand truly that obesity is not a choice. It's not a choice.
Mm.
I did not ask to be born 10 pounds, 5 ounces with like born into a family that has a genetic component of obesity. And I didn't ask for that. I didn't ask to be born with PCOS. I didn't ask for that. I didn't ask for, to become a type 2 diabetic later in my life. No one asks for these things. And I often feel that providers don't have enough education to understand those things. Even with, like I said, there's a lot of misinformation or misunderstanding even around type 2 being a chronic disease, even for
Yes.
providers, which is wild to me. So
Yes.
those two things. And then three, I guess that's tying in a bit to number one, having compassion. having compassion I wish more
Mm,
providers had. And I think that ties into the lack of education and therefore ignorance.
mhm,
Not excusing
mhm.
it, just saying I think that's the why behind it.
Yes, yes, I agree with
And
that.
and so that's kind of where what I would like
I love
for
that.
that to
I
happen.
love that.
Hmm.
I love that. Yeah, and I would agree with you. You're spot on. And those are the things that actually not only do I advocate on this side of my life, but also in the work that I do by day, is that
Hmm.
really helping people to understand. Like we all have bias. Well, I don't care who you are. We have bias about many
Yeah,
things, right?
of
But I
course.
think that right. But I think when you are dealing with someone, like you wouldn't, if somebody came
Hmm.
in the office and said, you know, I think I've got cancer, you wouldn't just look at them and be like, yeah, you know, yeah, whatever, come back and see me in 6 months, whatever. You wouldn't do that. You'd be like, hey, there's some tests we need to
Yeah,
run. Let's investigate this. You may not have that, but let's figure
yeah,
it out together, right? And I think
yes.
that's the same type of
Hmm.
compassion and care and curiosity that we want from our providers, right?
Hmm. Oh
And I
yeah.
think, yeah, so I think that those are excellent points. And
Hmm.
so what would be three things you would want to leave with our listeners, with people who maybe they haven't found us yet, maybe they haven't
Hmm.
found the GLP-1 communities, maybe they haven't found the obesity, maybe they haven't
Hmm.
found the Dear Healthcare Provider podcast. What would you say to
Yeah.
people who are out there and may feel like, oh my God, I'm by myself?
Oh, well, three things, right? Okay, so the first thing is if you happen to stumble upon this podcast, it's incredible. And you're not alone. I mean, that's like, I want to get that on a t-shirt because it's so true. Like, you are not alone, whether you're a slow responder, high responder. We all have, there's truly pros and cons to everything.
Mm-hmm.
And if you're feeling like it's just you, chances are it's not. So that'd be
Mm-hmm.
number one. Um, and then number two, obesity is not your fault. You are
Mm-hmm.
not choosing this day in and day out. It is not your fault until society can get on board and understand that it is a true complex chronic disease, that it is a
Mm-hmm.
metabolic dysregulation. Um,
Mm-hmm.
I think that's just it's always going to be that narrative that it's a choice. We're lazy. We're not. You're not lazy, and it's not a choice. And number three, uh, kind of twofold, having grace with yourself along your health journey.
Mm-hmm.
There's no, in my opinion, end destination. I believe it's a lifelong thing.
Mm-hmm.
And also just having compassion for yourself, grace with yourself, and compassion for others, because we really don't know what someone's going through at the end of the day. We really don't. Behind the scenes, you only see so much, obviously, of what I post. Have
Mm-hmm.
compassion for people and try to be understanding. And that's kind of where I think, the
I
three things
love
I would
that.
recommend.
I
Hmm.
love that. I love that. Thank you so much. Well, there's, you know, normally
Yeah.
I start the podcast out with this question and I didn't because I wanted us to dive right in, but I'm going to end
Hmm.
this episode with
Okay.
um, I always ask my guests, what are three things that makes you smile and brings you joy?
I love that question. That's such a thoughtful question. Three things that makes me smile. Well, I am very close to my family, my parents, my sisters, and then of course my actual family, my partner Adam, my son Arlo, and his mom Jackie. She lives with us, and so I would say my family. My son makes me smile. They bring me joy. It just makes me want to cry like thinking about it. I have such support in my family, and coming from a family that it's a lifelong line of obesity and diabetics. They just get it, and I'm so
Mm-hmm.
grateful for that. I know not everyone has that in their family. So that'd be number one. Number two, honestly, the community, knowing that I can connect with other people who are also like-minded outside of my family, and just hear other people's stories and helping people. Like, just again, just if I can reach one person to and let them know that they're not alone, and that obesity is not their fault, it's not their choice, or type 2 diabetes or what have you. I feel like I've done my part in the world. That's why I'm
Mm-hmm.
such an advocate. And then number three, honestly, I love music. Music makes me just smile, and it just evokes such emotion, doesn't it? And so music is really important to me.
Oh, thank you so much. I love that.
Thank you.
Well, Stevie, thank you so much for taking time out of your day on this Saturday. I don't know if it's cold where you are. It has been very cold
Little.
here in Pittsburgh.
Yeah.
But
Oh, I bet.
yes, because I know we're all busy, and I'm so grateful that you were willing to come on the podcast and that you didn't think I was a bot when I reached out to you
No.
online.
No, I didn't, Michelle. Thank you so much for this opportunity and allowing me to have a voice and just share my story. And I just appreciate you, and I love that we've connected.
Absolutely. All right, my dear. Well, I will be in touch. And until
Okay.
next time, I wish you joy, I wish you peace, and I wish you good health.
Oh, right back at you. Have a great day.